Created accessible, engaging learning materials for public health professionals out in the field that they could fit in around their busy lives to build their skills in public health, social marketing, and ethical programming to address childhood obesity and weight stigma. With the Strategic Training Initiative for the Prevention of Eating Disorders, we have a case method creation program where we develop curricular materials that can be used in public health classrooms around the country or around the globe to bring in topical, cutting-edge issues in eating disorders prevention into public health classrooms. We created, I think, 8 teaching cases for traditional in-person classrooms. Very excited about that work. Great body of work, never been done before, anything like that. And then we realized, how many people can we possibly reach if we stay limited to traditional in-person implementation, teaching in a traditional classroom? How many people who are public health practitioners can get back into a college or university classroom? They don't have time. They're working out in the field. They need the education to come to them. They need training opportunities to come to them, to meet them where they're at, whether they're working on this before work, after work, on weekends, on vacations. We need to give them something that they can really integrate into their busy working lives. Some of the key design elements that we need to figure out is, how do we capture the experimentation and the energy of case method teaching and active learning in an in-person classroom where you can see your classmates work together, you can build off each other's energy? How do we capture that and bring that into a digital platform where they are not face-to-face in a literal sense? They're not in the same classroom with their classmates on this. But we still want to capture that energy, that engagement, and that spirit of experimentation, and to being able to work really collaboratively together, even though they're not sitting in the same room together. That was the overarching challenge. So we were very committed to the case method teaching and active learning principles, because we know the evidence shows this is the strongest way to ensure people understand the material, can internalize the material, and most importantly, translate it to apply it out in field settings after they're out of the classroom. We want to change the way public health practice is done. They need to have all those steps and be able to translate it into their work out in the field. So we needed to keep the energy and the real evidence-based core of active learning and case method teaching, but be able to deliver that in a really very different format, working in digital communities.
And what was really helpful with that was that working across the different teams, the partners that we worked with, Dr. Chris Deedy with the Harvard Graduate School of Education, who has a huge amount of experience with teaching and with case method teaching, and as well with just really transformative technological thinking around how do you do this well. And then 2 other partners, Adrian Phelps-Coco and Karina Lin, and they're both with the Division of Continuing Education. And they have a lot of experience with enhancing engagement in online classrooms. And how do you bring that energy and that connection? And so we worked with them to think through some strategies for how to do that well. How to bring in certain activities or certain ways of integrating communications within the online course to bring that sense of community engagement to the course, because that was really important. There's a lot of times when people talk about online education, there's that lack that you don't get from the face-to-face, when you don't have the face-to-face interaction. And then how do you maintain, how do you get to know your students over the course of time? How do you do effective evaluations of courses in online courses? How do you balance the learning if there's different ways? So we really worked closely with them. We benefited so much from their knowledge, and they were responsive and engaged, and it was just a really nice meeting of the minds, transdisciplinary collaboration across different schools at Harvard. So it's a good opportunity.
Our team is just phenomenal. And then also we brought in Megan Kipp, who's a graduate of the Harvard Graduate School of Education, TIE, the Technology, Innovation, and Education Program. She's been working in the field for a number of years now, but she brings that training from Harvard, working out in the field at universities on digital education. How do we create online courses to keep the students involved, teaching a whole range of types of topics. She came on working with our team in that way, and she brought in a lot of really specialized knowledge of how do we operationalize a discussion when it's online. It's very different than leading a discussion in person. How do we handle sensitive topics online? And then Karina and Adrian were especially helpful around that too, because one of the topic areas we were dealing with was weight, stigma, and discrimination. And there's an enormous amount of weight shame that even our learners may experience. That's coming into our virtual classroom just like it would in an in-person classroom. So there's a lot of kinds of issues to think through. Some that might be generic in a sense that any online course needs to handle, and some that courses that are dealing with really critical public health issues or mental health issues have to be especially sensitive about.
We provided materials in different formats, so we did have the traditional printout or PDF that they give you online of the full case that they would read that was extensive and good, that had the story. We also built in an interactive case, so where they'd almost walk through it online and they'd experience it in a different way. So that was one way to bring that case to life for people versus just reading it on the platform. We certainly built in a lot of work with the discussion boards, and learned a lot from that experience in terms of how to evolve that process going forward. But there's a lot of opportunity for people to interact and respond to each other's projects or comments. And then there were group projects as well. So thinking through how would we bring these smaller groups together so they can learn from each other, to have discussions with each other, setting up conference call lines so they could schedule times to actually have a conversation and begin building relationships, and then begin building these projects so that you could bring the intimacy into this kind of larger classroom or online approach to learning. Proud of, because I was involved with it from start to finish, was the workshop we ran as part of this grant. So we were able to convene a variety of instructional designers, professors, program developers, course designers from across Harvard, people who are interested in bringing case method learning to the online space. Some of them had been doing it, some of them were interested in doing it, at all different levels of experience. And they came from across Harvard, and one person even came from MIT, and convened for a half-day workshop. And we had Chris Deedy was a speaker, we had several speakers, and they talked about a variety of very applicable. We talked about lessons learned from their experiences. We talked about specific tools that were used for evaluation, for using peer evaluation, ongoing evaluation, that talked about experience and smaller goals. I mean, these were tools that people were just dying to have. And then we had a mini hackathon at the very end where we had people work in small teams and develop an instructional design plan for one of Stripe's new cases that we're hoping also do the same with, bring it into the online space and be able to pilot it and take that to the next phase. So everyone came out with a deliverable of sorts, and so they were able to present their ideas to the broader workshop, and it was just, they walked away with that experience, to be able to connect with other people. The greatest value, I think, of that was what the feedback was across the board. We are so grateful to have had this opportunity to connect with others across Harvard. We do not get this opportunity enough. There are so many resources here that we can share and continue to connect with each other.